She has CCSVI and has been cursed with the label of MS. So please put your hands together for Denise Bailey.
Yeah, look at her go. She's doing good. Are you mic'd up?
Well, like he said, my name is Denise Bailey, and I am an MS expert and a CCSVI expert because I have both conditions. Two conditions I have, two separate conditions. Any knowledge of either condition that I've learned myself by absorbing every piece of information I could find. My neurologist certainly didn't help me. He just wanted to get me into one of his drug trials. Most of the information I got from him was about the crab drugs that have been being prescribed for years without doing much good for anybody. I told him about my not even being able to sleep at night, and sometimes being so tired I can't even hold up my head. And his reaction was to give me antidepressants and tell me not to sleep during the day. And of course to push me to go into his drug trials. I've been arguing with doctors for years that something is wrong with me and written off as a hypochondriac by many. And then one morning in late July 2006, I was in the shower and I couldn't feel the temperature of the water with my left foot. So I turned it up a little hotter and then I checked it with my right foot and nearly scalded myself. So after dragging my leg around at my workplace for a couple of days and wasting a few hours on a trip to the Medi-Center, where the reaction was to jab a needle in my leg, say, yep, it's numb, we'll send you for a back x-ray, even though I hadn't injured myself. My GP told me to go to the U of A emergency room because that's where the MS clinic, and he said the neurologist there knew the most about, he said the neurology department there was really good. I think at the time he suspected I had MS. But after laying on the slab in the emergency room for 3 days without showering, and they say there's nothing wrong with the Canadian healthcare system, and of course not getting enough to drink, they decided to give me a lumbar puncture, something I'll never do again. So I felt like my head was in a vice. Laid flat on a bed for 2 days without even a pillow. And then they finally sent me home. They told me it looked like it was transverse myelitis. They said it's probably just a one-shot deal. There's a really tiny chance it could be MS. But I've been fighting with doctors for years. I knew there was something wrong with me more than just this little one-time deal. I now know that, yeah, in 2006 is when I had my first major MS attack, but I've had CCSVI at least since I was 15. So sure enough, another MRI in January 2007, and I had the label of MS slapped on my forehead. I got books at the library and looked online to find out everything I could, some of the strange things that were being done. Of course, we all know the bee sting thing that keeps getting thrown up every time we mention CCSVI. And then the story about Dr. Zamboni aired and everything changed. I went to my neurologist and asked him about CCSVI, and of course, him being a neurologist, I got the distinct impression that he didn't like the idea of it. Of course, it was a non-drug treatment. So I kind of think of my neurologist as just a legal drug pusher. And it's a very good thing that he didn't help me to research CCSVI, or I would have been fed the same garbage that they've been feeding all the media and everybody else to prove that CCSVI is terrible and dangerous and doesn't exist. You know, all these studies that can't duplicate the findings of Dr. Zamboni, well, they're not using his methods or his protocol, so of course they're not going to be able to duplicate his findings. You have to do the same thing to get the same result. They keep trying to compare apples to oranges, and I've never seen an apple that looked like an orange or tried to be an orange. I actually used to have faith in our medical and political systems. I wanted to volunteer where the first studies were done here in Canada. I tried to get my GP to help me out, but there wasn't a lot he could do to get me in one of the studies being done in the US. So I joined CCSVI Alberta and rallied with them. I was introduced in the legislature several times, and still nothing was done. All the while I've been getting worse and worse, and nothing's being done, at least not in Canada. I just have to go into severe debt, put myself in a debtor's prison, like Warren said, and go to another country to get a treatment that can be done in Canada and should be done in Canada, but they won't let us get it done in Canada. They keep harping about its safety and efficacy not being proven. Efficacy of treating is hard because most of the symptoms of CCSVI are subjective, and they have to stop looking at just people with MS. There are other people with other conditions that have CCSVI. But safety. An article in June 2011 in Cardiovascular Business was titled, this is the title, Angioplasty for MS, Patient-Driven, Safe, but is it effective? That was a cardiovascular medical journal that stated right in the title of the article that it's a safe procedure. And then there was a group of doctors from Albany, New York that just published a study in January that covered 240 patients with 257 procedures and found the 1.6% risk of any serious complications. And about half of those had stents put in. As Kirsty said, 30,000 procedures have been done worldwide. I looked really hard online and I could only find 5 serious events. The 3 deaths, and there were 2 other serious non-fatal complications. Now, this simple outpatient procedure still, that only takes a couple of hours at the most, is just a new application of a common routine procedure. And I don't know why it needs to be proven safe when the Canadian government is okay with a drug that's given deadly brain infection to 242, you said now, and killed at least 46 people. They're okay with that. I went to that drug's website to find that information. You scroll down on the same page on their website and it says, but it looks like this drug is safe for pregnant mothers with MS. They're trying to feed it to our unborn babies now. Up to 95% of people with MS have fatigue and heat intolerance is so prevalent that they used to use what's called a hot bath test to diagnose MS. These are the symptoms that more than any other have made my life stop. I can't do anything because of them. Yes, I have MS, but it's my CCSVI that has stolen my life. And our Canadian government says, wait and see, and pack a supposed advisory panel full of experts that are naysaying neurologists and doctors in the pharmaceutical companies' pockets. I never used to be cynical until I started the fight against CCSVI, and it showed me the truth of things. I can't afford to wait. I have a 9-year-old daughter that needs and deserves a mother now. Do you know how much it hurts to look at a 4 or 5-year-old child and tell her that you can never take her to a park to play? That you can't take her to go to a friend's house because you're too tired? I just want to be a mom to my daughter. And the Canadian government says, no, no, wait and see, wait and see. I don't have any more time to wait. I need this done now. I can't afford to wait now. I just want to be better. That's all I want. Even if it's only for one day and then I drop dead the next day, if I can be better for just one day, it's worth it. Kirsty, you said that people with MS aren't going away, but we are at the rate of 400 people a year. We're dying while we're waiting for the government to listen to sense and reason and give us just a little bit of relief, even if it does only last a little while. I heard of a study in Poland. It was done by neurologists, by a bunch of ones trying to disprove it. They said, okay, didn't present any clinical improvements, but even those doctors who followed people who had CCSVI treatment said that after 6 months, most of those people had clinically significant improvements remaining to their fatigue and their heat intolerance. Those are the 2 symptoms that stop me from living. If I could get rid of even one of them, even for just a couple of months, it's worth everything I have. We can't stop this fight. This is too important, if not for us, then for the children and the young people who are just being diagnosed with MS now. They're the ones who can benefit the most from this treatment if they get it now. I don't expect to stop my hand feeling like I'm holding onto an electric fence. But if I could get rid of my fatigue and my heat intolerance, it's worth it. But those people who are just starting to have problems now, they can and should be able to see if they can stop it from ever happening in the first place. We have to keep on with this fight. We can't let the Canadian government get away with just telling us to hurry up and die. Thank you.